Why do patients get labiaplasties?
Patients get labiaplasties for a variety of reasons. Patients get labiaplasties from all age groups. I've had patients as young as 13 to as old in their 60s or 70s. The most common reason is because they don't like the size of the labia minora, which is the inner lips. And that can be genetic, they can be born with it, or it can increase in size. Most of the time it increases after childbirth. And it usually bugs the patients, they feel it, they see it in their clothes, and it can interfere with sex. So most of them want it reduced to something that's more aesthetically pleasing.
What are some things that you offer for labiaplasties that people may not know about?
Not only do you have an enlarged labia minora, you can also have an area of skin above the labia minora called the clitoral hood enlarged, and that area can be also excised to be brought down so it's more proportional. Patients sometimes also have volume deficiency in their labia majora or their outer lips. And that can occur at basically almost any age. I've seen it as young as patients in their 20s, and it's much more common as patients get to be older. Menopausal, postmenopausal is much more common. So you can have skin laxity and you can also have volume deficiency. So with younger patients, I will offer them volume replacement, something that's more long-lasting like fat. So a lot of times I will offer fat grafting to that area. I can harvest fat from a diet-resistant area, usually like the hips, and that will usually provide good quality fat, and usually once the fat takes, it usually will be long-lasting.
And how intense is the procedure? Like, do you have to go under general anesthesia?
For a straight labiaplasty with fat grafting, or even if you excise the skin, some patients also choose to excise the labia minora. So those patients can have oral sedation with local anesthesia, and in my experience, the majority of patients tolerate that just fine. Once we numb it up, they don't feel anything, so they will just listen to their headphones, listen to music, or they will just sleep during the procedure, basically. So they tolerate it pretty well with just oral sedation. And some local anesthesia, of course.
And are your patients happy with their results?
The majority of patients are going to be happy with the results. They are happy they don't have the increased size. They don't like to see the labia when they stand up. Usually they feel a difference in their clothing. And so the majority, I would say 90% are happy with the results. Sometimes you have to do a little touch-up here and there, but in general, most patients are going to be very happy with the results.
And what sets you apart from other cosmetic surgeons who do labiaplasties?
I kind of offer more things than most people do. We will, like I said, take a look at the labia majora, offer permanent volume replacement. You can also put PRP, PRF. Some people put biostimulatory fillers in there, but they don't last that long. So I pay attention actually to the whole aesthetic unit of the female genital area, and I kind of offer comprehensive treatment plans based on the patient complaints.
And how long have you been performing labiaplasties?
Ooh, let me think. I would say close to 20 years, so about 20 years, but it's become, I would say in the last 10, 15 years, much more popular and much more widely discussed, and patients are asking for it more and more.